Good afternoon, and welcome to the Quest Diagnostics sponsored webinar, Making the Most of Front Office Technology. My name is Colby Dix, and I will serve as your moderator and host today. We have a lot of material to cover in this hour, and we're very pleased to have Laurie Morgan with us to discuss front office technology and improving your office workflow. Our overall agenda for today is on the screen for you now. We'll dive directly into Laurie's presentation shortly, and there will be a Q&A session directly following. And please also stay with us for a brief overview of Quantum's healthcare IT portfolio to close out the hour. We can extend a warm welcome to our presenter today, Laurie Morgan. Laurie's bio is up on the screen now, and you can see that we're very lucky to have someone with such experience available to us. Her extensive publications and years of dedication to healthcare IT have earned her great renown in our industry. And as a partner and consultant with Capko Morgan, she's consulted with clinicians and practices nationwide, and her Management RX series of ebooks are invaluable tools spanning the breadth of practice management. So we welcome Laurie Morgan.
Thank you so much, Colby. I'm so happy to be here. As I think you know, this is one of my favorite topics.
I know, it's definitely one that you speak well on, and we're very excited to have you here today. We'll dive right into our feature presentation now, and it will follow a loose sort of question-answer format in which I'll be asking these 10 questions of Laurie, and she'll relay a wealth of information on front office tech and workflows that we think will benefit your practice. And getting started with question number 1 on the board, Laurie, why is now the time to focus on front office technology?
Well, I think we're sort of seeing a number of trends converge that make it a really good time for practices to kind of refocus on technology. I think that for a long time, the primary technology focus in, at least in most of the practices we work with, has been on getting the right EHR and getting that EHR to work properly and customizing it. And the practice management side of things, you know, those systems were older, they'd been in place for much longer, and, you know, there wasn't much thought about how those things could be improved or how that side of the operation could be improved. And meanwhile, the vendors have actually been innovating really quickly, and they're responding to some other trends in the market, including probably the biggest one, which is increasing payment responsibility. And, you know, with high deductible plans, basically even employees with insurance from their employers are now facing deductibles in most cases. And so there's a lot going on the insurance side that has really prompted the need for better tools. And the good news is that vendors have really been responding, and it's a great opportunity now for practices to take a closer look, especially because many of the things I'm going to talk about today may already exist in the systems that practices have already deployed. You know, inside that practice management system that they're already running, there may be some new tools that you're not aware of, because most of the time it's a little bit hard to keep up with all of the release notes and, you know, all of the updates that our vendors are doing. So I want to just walk through some of the most important innovations and how I think they can really help elevate practice performance. One last thing. So I mentioned that a number of trends are converging. You know, there's the insurance side of things, patient payment responsibility. These are big challenges for every practice that we work with. And then, you know, in a completely different side of things, we've got patient expectations. And, you know, all of us are getting used to doing things more remotely or doing things on the go with our smartphones. And that's especially true of millennials and, you know, younger patients. Now, if you're an OB practice or if you're a pediatric practice, you may already be feeling some of that pressure because some of these, you know, younger patients and parents are wondering, hey, you know, why can't I book online with you the same way I do with other services that I you know, try to schedule, or why am I not able to pay online? And, you know, they're voting with their feet. If they don't get the kind of service they're used to, they can move on and choose another practice. So meeting those expectations now is critical if you're serving that younger audience, but those preferences that millennials are driving are also filtering through to all of us older people. And, you know, I read some research recently from the Pew Research Center that show that more than half of Americans now have a smartphone. So this idea of doing things on the go is affecting not just younger patients, but older ones. And of course, as the entire population ages, those preferences are going to move along with the patient. And the practices that learn now how to serve those needs better are going to be much better prepared for the future.
I think that's a huge consideration, and one that is, it's happening throughout our lives, obviously not just in the medical community, but it's hard not to see that same trend happening here. When you think of just the absolute ease of that experience, whether you're booking a hotel or something like that, or just especially in terms of scheduling and things, that alone is got to be one of those key components that we'll talk about here in just a few more moments.
Absolutely.
Moving on to question 2. Laurie, there must be a few examples of technology that are underutilized really at this point perhaps, but that should be more widely accepted, much like as I was referring to scheduling and things like that. A few ideas that we've certainly heard about, but maybe we haven't implemented in our own practices. Could you share a few of your favorites perhaps?
Yes, and that's really a great way to put it, that some of these things are available now. They're not hard to deploy. They're available inside your existing systems or often with an add-on system that's really easy to get going, and yet your practices maybe aren't aware of them, or they're not using them, or they don't totally understand how beneficial they can be. So these are the categories of things that I think are the most important to take a look at. Now, most practices that we work with already have some kind of integration between their practice management system and the EHR, but if you don't, or you're not integrating really tightly, it's definitely worth it to talk to your vendors about this. Now, what I mean by that is, you want information to be passing from one system to the other so that you only have to enter data in one place. Whenever you have to enter data more than once, it creates a huge opportunity for errors, and the types of errors it creates are really time-consuming to fix because you don't know whether the information in the EHR is right or the information in the practice management system is right. Same thing goes, if you're entering the same thing in multiple spots inside your practice management system, creates not just an opportunity for error, but also the kind of error that really can be time-consuming to fix. So the more integrated your systems can be, the better. Now, if you haven't got any integration at all, like if you're still manually taking claims information out of the EHR and putting it into the practice management system, it may be the case that you didn't realize your systems could be integrated. And, sometimes practice management systems from different vendors from your EHR still can achieve some level of integration. The vendors really know how important this is, and they've been working on it. So if you have in the past just assumed you couldn't be integrated, talk to your vendors and make sure that that's still the case. Even if they can't do it, by the way, it may be worth looking at having a developer design a linkage for you because it's just too valuable. It saves saves too much time and avoids too many errors to not look at it. The other thing is that if you are thinking about a cloud system, I encourage you to look very closely at it. If you are thinking of moving to a new EHR or practice management system platform, definitely a great opportunity to take a look at the cloud. Also, in many cases, vendors that previously offered only in-office server-based systems, like you may have a server in your office, they're now offering a cloud version. If that's the case, I definitely encourage you to take a close look at it because there are some huge advantages there. And by the way, one of the trends that is helping to make all this innovation so much more attractive and make it so much easier to take advantage of is the cloud, because the cloud allows your technology vendors to distribute updates much more easily than they can be done when you have to update your own server in the office. So I strongly encourage you to take a look at that either with your existing system or if you're looking to switch. The next category, insurance tools. Now, I have to say, eligibility checking, first of all, it's become more important than ever. And second, it's one of the things that's most commonly overlooked when we work with practices and also when we talk with vendors. They report that it's commonly overlooked or people don't understand how strong an eligibility checking feature there may be inside the practice management system that you're already using. So what I'm referring to here, it's usually called something like real-time eligibility. Basically, the idea is that your staff person can actually click a button inside the patient's demographic record, assuming that the insurance information has been entered. Then the system goes out, talks to the health plan, and returns a response that confirms or lets you know that the patient is ineligible, confirms their eligibility, or lets you know that they're not, and also usually returns information about the deductible and the copay and other details that you need. And so it's incredibly efficient compared to going to an individual payer's website and having to exit out of the practice management system, go to that other, either that other intermediary system or go to the payer's website and then copying that information back into the system, because the other big benefit is with that eligibility checking, the record gets updated automatically, so there's much less opportunity for error. So if you're not using this now, or you're not sure exactly how it works, or maybe it's something you have to activate inside of your system, absolutely check this out. I think it's essential in our environment where, number one, we have to prepare patients to pay more effectively. So I'd like to see practices doing this eligibility check at the time of scheduling so that they can also inform the patient about their payment responsibility. And then also we're seeing patients switch plans a little bit more. The need to check closer to the time of the appointment has increased. And one thing I will say about that is that a lot of times, in addition to this real-time check, systems have a batch version of the check, which can be set up to run automatically, doing all, checking all of the patients that are scheduled to come in 2 or 3 days before, so you can catch anyone whose plan might have changed before they come in. Now, imagine all the problems that can solve, because if a patient doesn't find out they're ineligible until they get into the office, imagine how unhappy that patient is going to be. They'll have to decide whether to be seen out of network or whether to go and try to find another provider. And then sometimes, maybe that's not even caught at the front desk, and then the patient is seen, and either they have to, end up paying a much larger portion of the cost, or sometimes the practice won't get paid at all. So this is a really critical tool in our current environment. So a couple of other insurance tools I think practices should take a look at. Prior authorization. The electronic tools for this have gotten much better, especially on the drug side. And most of the systems that are out there, they're not built into your practice management system like the eligibility thing is. Usually you have to add something on, but they're very well integrated, and there are just a few vendors out there to take a look at. Make sure you're taking advantage of that, because it can be worked right into the workflow for your e-prescribing and make things so much easier for both your practice and your patients. Estimation technology is another type of tool that is not typically built into the system. It's an add-on. It usually comes from a clearinghouse technology vendor, but it's definitely worth looking at if you're having a lot of problems with patients, wanting to know in advance how much they're going to have to pay for a large procedure and wanting to be able to set up payment plans.
And this is all really all the more pertinent when you're looking at the higher deductible style of plans that most of us are sort of burdened with now compared to previously. Those tools with eligibility, prior authorization, and estimation can take a lot of that worry off the table, because reimbursements are all the harder when you're looking for a lot more from the patients up front, and that communication early on has got to be huge comparatively.
Yes, absolutely. I think that's one of the biggest things that we need to kind of shift. If some practices have made the shift already. If you haven't yet, it's really important to start thinking about making the patient aware of what their payment responsibility is as early in the process as possible. And that's for their benefit too, so they don't get an unpleasant surprise. So moving on to the payment side of things. So the other issue, Colby, you just mentioned about the high deductible plans. Of course, in many cases, patients may now understand that they have to pay and be prepared to pay, but perhaps they need to pay over time, or perhaps they want to pay, over the internet rather than actually writing a check. Actually, this idea of paying by check versus paying online is really crucially important. There has been a massive shift in payment patterns across every industry, and The post office even has reported that their business is way, way down. Their single-piece stamped mail business is down about 60% over the last 10 years, and they attribute that specifically to people no longer mailing in checks to pay their bills, right? They've become used to going online and making their payments that way. It's much more convenient. They can do it in the evening or whenever. They don't have to call in and provide a credit card, or they don't have to go to the post office and get themselves a stamp. And so, you know, in our practices, a lot of times we're not really in step with that. I mean, when we work with practices, we always ask them what are the number one things that patients are complaining about, or, you know, saying they wish were different about dealing with the practice, and the ability to pay online always comes up. And I think sometimes practices hold back because they think, well, a payment portal, you know, we went through this whole process of launching our EHR portal, and it was really hard to get people to use it. We're afraid the same thing will happen, or, you know, we're worried about privacy. There are lots of different things that hold practices back from, you know, launching these tools, but I've got to tell you, they're actually usually very, very easy to launch, and they will make things so much easier for your patients. And when you make things easier for your patients, you're more likely to get paid more quickly. So it's really, this is a really important technology area for practices to look at. And then finally, you know, self-service. Self-service is just a big trend among millennials, among all of us really, but, you know, millennials have, you know, grown up this way. They are used to being able to do things on their own schedule. They've never really had it, you know, the way that baby boomers and Gen Xers have had it, where we've, you know, transitioned to doing things using technology. This has always been the way for them. And so, you know, they find it very disruptive to have to handle something with a phone call rather than doing it online. And so to the extent that you can get in step with that, you're going to make things so much easier for that patient. The relationship's going to be stronger. They're going to be more likely to refer you. And, you know, by the way, it's a total win-win, because as you adopt these things and adapt your workflow, you're going to find that you're actually transferring some of the effort over to the patient, right? So you're going to free up some capacity in your staff, because some of the workload is actually being transferred over to the patient, and they will even thank you for letting them do the work themselves. So it's a total win-win.
Yeah, and removing as many of those barriers as possible for your patients, really. And I know that is, I can't claim to be a millennial at this point. I couldn't quite qualify, but I'm the same way as far as, you know, both in terms of you know, paying things online or anything I can do to help to automate or simplify that process. I am 100% for, because it's just one where getting rid of any of those barriers, whether it's checking in using a kiosk perhaps, or helping to, you know, being able to enter some of your own information, and to reduce the amount of transitions of that same amount of data. It just win-win, as you say, on every side.
I was just going to say about the check-in thing, you know, it's kind of funny to think that we can check in with the DMV or with an airline, you know, using the internet, using our smartphones, right? And I don't think there's any practice listening that wants to, you know, be thought of as having the same level of service as those two industries. You know what I mean? I mean, we can do better, surely, than those entities, right? And we want to be providing not just what they can do, but even better service.
Absolutely. And recalling the first bullet now, we'll shift our focus a little bit back to cloud-based technology. It used to be that the majority of our office software and the data was stored locally, either in the form of paper files or on a server in the office, perhaps. But things have really shifted to the cloud, not just in doctors' offices, but in all aspects of life. And what is it then that makes the cloud, you know, so much more ubiquitous now, and indeed so invaluable?
Well, so I think there are a few reasons, as I listed here, why I think everyone should be really considering shifting to the cloud. One of the biggest ones is this idea of built-in redundancy. So we think of the cloud as this, you know, single place. So it's sort of mysterious, right? The whole name cloud is a little bit mysterious sounding, but basically what we've got with the cloud is, you know, multiple locations where farms of servers are, you know, sitting, and they're hosting all of these systems. And what that enables is the cloud service provider or your tech platform to have the same information available in multiple locations. So if there's a power outage in one location, or if a server goes down in one location, you'll be working along and you won't even realize it because the load is automatically shifted to that other part of the cloud network. So it's amazing, and that's something that you can't replicate. There's just no way to replicate that in your own office with your own server, and I think it's hugely important. The more we rely on systems to run every aspect of our practices, and that particular feature is really valuable. The other thing is that, you know, many times physician owners, practice managers, healthcare executives talk about security and they're a little bit nervous. You know, is the cloud going to be as secure as a system inside of our office that we control? Well, if you think about it, the most sensitive information that we deal with on a daily basis, like our banking information, for example, government information, all of that stuff is now hosted on the cloud because there are, you know, armies of security experts who are actually helping to keep that information safe. And you know, if you're using the cloud, you have the ability to tap into all that expertise, whereas if you have, you know, your own server in your own office, depending on the size of your practice, you may not even have a full-time IT person, let alone a whole team, and much less a team that includes people who are totally focused on security. So I think you're really able to tap into expertise that's just impossible to get on your own in most cases. The other thing is that, you know, security, hacking, that type of online security is the first thing that we think of when we think about security. But, you know, don't forget that we also have to keep our data secure from natural disasters and even theft inside the office. We always tell our practices, you know, your data is really only as secure as your office because someone could literally come in and steal your server. So that's something to think about. Also, here in California, recently we had these horrendous wildfires that just leveled whole sections of the wine country, and you know, if something like that is to happen, your server is gone. Now, you may have a backup, but a lot of times backups aren't as reliable or as easy to restore as we would like. So I feel like this, you know, ability to have this redundancy and have the data always stored off-site can be really helpful. The other thing I think I mentioned in the very beginning, you know, updates are so much easier with the cloud. That is one of the things that has really spurred the innovation we've seen in practice management systems. And also, you know, because everyone is basically remote, if someone wants to work remotely, it's very easy for them to do that. You know, you're all accessing the system via the internet in the office. It's just as easy to do that on the go. Finally, I just, you know, the little thought bubble there is something that's always on the mind of our practice clients. You know, how much does it cost to get these systems going? Well, many times with the cloud, it can be less expensive because you're just going to add a little bit of software, you know, download a little bit of software onto your existing computers, and you're good to go in just a few moments. And you're adding, you know, users paying a monthly fee for each user. The cost is much more predictable and manageable.
And even thinking about that in terms of that remote access and multiple platforms and multiple users even. Now that's not just, you know, the doctor necessarily the patient, that can be the doctor, other specialists and other doctors within the same or similar networks where that information can be shared readily and easily and not be just struggling with the transfer of that information across things when it's more or less immediate if they're on the same system. Which is just valuable as far as getting care in a timely fashion. That's got to be a huge advantage alone. And with technology being such a major part of all of our lives these days, and it seems like everyone is carrying a connected device in their pocket, whether it's a smartphone or a tablet, and there are some distinct advantages to improving the front office tech for our patients as well. Laurie, how can we leverage these concepts and others like them to improve our patient service?
Well, you know, one thing I want to do, actually, I want to jump to the bottom bullet first, because I think sometimes we assume that talking with a human is more appealing than interacting with a computer. But I think increasingly people are starting to realize that it's just so much easier to get things done quickly if you can and not have to pick up the phone. And so I think it's really important to be careful to not overestimate how valuable human interaction can be. In some cases, of course, the human touch is so important, but It's less so with things like scheduling or paying a bill. You know, it's a little bit more of an impediment in those cases. So what technology, I think, allows us to do is make the things that are purely administrative more efficient, and then allow us to focus our human touch on the things where that really adds more value for the patient. Now, with respect to making things more efficient, I think that one of the most important things that implementing better front office technology can do is eliminate some of those surprise bills that patients get, especially if they're on a high deductible plan like we've been talking about. You know, Consumer Reports did a study last year. They found that more than a third of patients who are on employer-sponsored health plans have been hit with a surprise medical bill, you know, an amount that they were not expecting. And in a significant number of those cases, the patient was never satisfied that the bill was accurate, and so they didn't pay that bill. So there you've got like a total lose-lose, because the patient is upset to have received a bill that they didn't expect to receive, and they're skeptical. So they think that somebody is trying to make them pay money that they don't actually owe. Terrible for the relationship. If you can prevent some of those things from happening by explaining explaining the patient's health insurance terms to them in advance and kind of walking them through it right from the very start, you're going to help avoid that problem of a big surprise. And of course, if you combine that with the ability for that patient to pay easily over time and discreetly over time, you're going to make the whole process so much more comfortable for that patient. Remember, I mentioned before that these days many consumers, and that includes patients, prefer to help themselves rather than have another person walk them through something. You know, convenience is really important. I think the convenience part of this is probably a little bit more obvious than another benefit, which is the privacy part of this. I think when a patient is hearing for the first time that they're going to owe a significant amount of money when they're arriving at the front desk in front of other patients, it can be awkward for them, maybe a little bit embarrassing. If they have an outstanding balance and the front desk person is trying to collect that at that time, that can also be a little bit awkward and embarrassing for the patient. And so some of the tools that you can add on, like check-in kiosks and tablets where the patient can see their balance, either pay it off or set up their own payment plan, that takes away all of that negativity, puts the patient back in control, and, you know, by the way, makes it much more likely that you're going to collect that revenue more quickly. Same thing with the ability to put a credit card on file and just set that patient up for a payment plan that makes it easy for them to pay a larger balance off a little bit at a time. Remember also, you know, I said that some human interactions are overrated. The other thing is that that's especially true when the lack of technology is making you less efficient. Just think about how annoying it is to be having to go through a lot of different steps to get accurate information about your bill, or, you know, to have to call someone and give them a credit card over the phone to make a payment. It's a little bit of friction that you can eliminate by deploying some of this technology.
I think it is interesting to note as well, even just that that familiarity that may happen in a lot of front offices and a lot of those of us who are working in the field. You know, you'll see this kind of thing every day, but for that patient, this is a very unique experience. So that's when something like that surprise bill, like where it might surprise them, might not be surprising to you, as you've already, you know, sent these bills out a few times, but we tend to forget over time or sort of take for granted as that day-to-day goes along that the patient themselves, you know, like this is usually a fairly unique experience, or at least we're hoping that it's, you know, both unique and meaningful to them. So to keep that in mind as well.
That's such a good point. I mean, they may already be under a lot of stress if they're ill, and then, you know, to get a surprise bill, it really can push the anxiety up to 11.
And it really speaks to making all of this more efficient for them. But with all of these advances, there, you know, some of the practices that are taking advantage of this technology, you know, they can't help but feel like they've automated a lot of previously manual processes. Do you feel that there's a push for practices to downsize as they add these automations, you know, or should we hold off on firing the receptionist just yet?
You know, this is a really important question, I think, because this comes up in all of our assignments when we're working with practices. You know, as soon as they start automating, they think, well, you know, can we downsize or should we downsize? And I feel like there's just a little bit of a misconception that having the smallest possible staff is the best way to run your practice. In fact, more often than not, when we work with a practice that's having trouble, we find that understaffing is part of the problem. So I urge practices to tread lightly with this idea that you're suddenly going to cut back on staff. The other big thing I want to emphasize here is that over the last 5 to 10 years, you know, all of these extra burdens of collecting that have hit the front desk in particular, but also the billing team as well, you know, they've all taken away from other things that staff could be doing that are really valuable for patients and really valuable to your practice business. For example, even simple things like tidying up the reception area. You know, sometimes the receptionists have a line that, you know, keeps them busy all day, and they're dealing with these collection issues, and they don't even have a chance to go up and just kind of tidy up and make the waiting area a little bit more inviting. The other thing is that, you know, if the receptionist has just a little bit more time, first of all, they can spend a little bit of time reassuring that nervous patient. Even just a few extra seconds being able to do that changes that patient's impression of your practice. They may also be able to spot problems, like a patient that's been waiting far too long, and then you have that flexibility to go to the back office and figure out what is causing that bottleneck and whether that patient should be rescheduled. So there are a lot of ways that service has been kind of gradually degraded, in my opinion, over the last 5, 10 years because so many new responsibilities have been assigned to the front office. So I think it would be great if we could restore some of those things that really improve the patient experience. There are also some new needs that I think that, you know, most practices are not able to take on because everyone is so busy. For example, managing your online reputation is a big one. You know, in virtually every practice we work with, we find that there is incorrect information on the internet about the physicians in their practice, even really basic things like where the office is located. And if staff has a little bit of free time, you know, they can help out and take care of, you know, some of these important tasks that are really, I mean, they're a form of patient service. They're also a form of free, very cost-effective marketing for your practice. You know, one of the reasons why we find that practices haven't deployed some of the tools that we're talking about today is that it's really hard to stay on top of all the things that are being rolled out, really hard to know everything that's available inside your practice management system. The release notes come, and if they're going to a busy manager or administrator or a busy physician owner, they're not going to be the first thing that busy person reads. Now, if you manage to take back a little bit of slack by deploying some technology that makes your practice more efficient, you have the opportunity perhaps to assign the monitoring of these technology releases to an employee who might have a real interest in technology. A lot of times in practice we find that there's that person who is like the informal expert that everyone goes to, the informal EHR expert who, you know, it's not in their job description, but everyone knows they're the person who really knows how the system works best. Same thing on the practice management side. You know, why not actually formalize that, give that person the chance to add a little something to their resume, even if they're not getting a raise, you know, they're not really being promoted, but they're getting that recognition for something that they're good at. And it also, of course, really benefits your practice because that person can make sure everyone's informed when something really good comes down the pike that you need to look at. And lastly, I just want to talk a little bit about productivity. Now, one of the reasons why we often find or often, you know, come in our analysis of practices come to believe that they could do better with more staffing is because staff really help your physicians to be as productive as they can be, right? Your staff are there to make sure that physicians are doing only the very high-level tasks that only they can do. Now, usually when we talk about that, we're talking about the back office staff more than the front office, or they're talking about the clinical MAs and nurses. But there are ways that your front office team can make your physicians more productive too. For example, one of the things that we have seen kind of go by the wayside when there have been too many tasks creeping onto the desks of the people in the front office is recalling patients. For example, recalling patients for their preventive visits. That's something that can be really useful to do around the first of the year when the deductible reset happens, recalling patients who really should have a follow-up. And then also a wait list. There's a wait list feature in many practice management systems that is hardly ever used, and it can be so useful for keeping the schedule full, and then again, giving that patient who wants to get in earlier that extra level of service, right? And that's something that it may be hard to squeeze in when everybody is completely at capacity all the time. So before looking at downsizing and before reducing staff, I really encourage practices to look at what are the things that haven't been getting done that could really add a lot of value. Before we think about trimming, how can we use our team better and be more productive and give better service?
I think that last one is truly an excellent point. If you can refine your practices, start to get your receivables in check and make sure that you're taking in money at an efficient rate. But then if your booking becomes more efficient, the wait list alone, that's something that you can easily show value in very quickly, both by filling in empty dates on the calendar, but by keeping people in for the regular appointments. If you get them in as necessary, and it is truly required that they might need to come in 3 or 4 times a year, the difference between that 3 or 4 is one more billable encounter. And if you do that across your entire patient set, you're talking some real dollars and cents here, which transitions nicely into our next slide. Moving on, we'll focus a little bit on those dollars and cents for the next question. How is the best way for us to evaluate the ROI of some of these technology add-ons?
Well, I just want to say that many times we work with practices and they're resistant to adding any technology if it has a cost. It's like a sort of instinctive thing, like we shouldn't be spending more money. And I just want to make sure, first of all, that you take a close look at all these tools, because in our experience, they mostly pay for themselves over and over and over again, and not just in the immediate return, but of course in providing better service as well and eliminating mistakes. I mean, mistakes are sort of a hidden cost. It's easy to underestimate how much time staff is spending on the back end fixing errors. And also, of course, some errors have a very tangible cost when a claim is denied, for example. So first of all, I just want to urge everyone to not reject out of hand the idea of adding some of these things because they may have a cost, because usually they pay for themselves very quickly. I think the first thing to look at is whether there's a direct cost you can compare against. For example, if you can set up a payment portal and then send electronic payment notices to patients, that knocks off a lot of costs right away, because you have the paper costs, the printing, the postage, and all that time that it takes for your staff to stuff those envelopes with statements. Then on top of that, since so many people have trouble finding a stamp and writing a check, you also save the staff time when someone calls up and they want you to process their credit card over the phone. So those costs are really very, very easy to see, and make sure at a minimum you're considering those, because oftentimes you'll realize, what, we have to pay a credit card handling fee for that portal, but it's totally worth it because look at all of the costs that we are eliminating. And also we're getting paid so much more quickly. The other thing is that when you're allowing, for example, patients to check themselves in or enter their own registration information or enter their own credit card information into a kiosk or on the payment portal, you're reducing the handling of that data. And especially with credit card information, there's always at least some risk that that information will be stolen, either by another patient that's in the office and happens to see it, or by, unfortunately, by someone on staff. So you reduce the handling of that data. That is a cost that the cost of that risk, you're also eliminating. Also the error risk, just entering that information. If a patient can enter their own registration information, usually they're going to get it more accurate than a staff member can, especially because it's often hard to read their handwriting when they have to write that stuff in on a form. It also improves your ability to understand how your practice is doing, because so many of the tools we're talking about are designed to make payments easier for patients. That gets the money in the door faster. That means your accounts receivable is going to give you a truer picture of what payments can actually come in versus which ones you're going to be chasing forever and are not actually going to be collected. And that, of course, brings me to the last point, which is the value of collecting more quickly and more reliably is just huge. I think that what happens a lot of the time is, if the patient is surprised by that bill and then they're not satisfied by the explanation, and that first bill comes 2 months after they were seen or had their procedure, it becomes very costly to try to collect that money from that patient, and ultimately they may not pay, or they may not pay the full amount. You're going to have a staff person chasing that for months, trying to collect small payments and creating kind of creating that negativity with the patient. So you are bringing the money in faster. That has a lot of value, and then you're eliminating that cost of collecting on the back end.
Excellent. I know we've been talking a lot about certainly the pros. I think both of us are certainly technology champions, and thinking that a lot of problems in our daily practices can be solved with better technology. But that being said, technology in itself isn't necessarily a silver bullet that's going to cure and fix all of your problems. There are, of course, some caveats and some pitfalls that we might want to avoid.
Absolutely. I think, well, here are my favorite pitfalls that I hope practices can avoid. The first is, there's a saying in technology, garbage in, garbage out, right? So if you are not putting the right information in the system, then anything you do to analyze that data is going to be compromised. In the case of a practice, we often see that sometimes there's garbage going in, sometimes nothing's going in, because people haven't been fully trained on how to use the systems, or they don't really understand why a certain piece of information is important to collect. I have a couple of examples, I think, that apply to a lot of practices. One is that with no-shows, many times we talk to practices and they say, oh, you know what, we run these reports and our no-show rate is fantastic, we hardly have any no-shows. Well, then when we dig a little deeper, we find that you've got really diligent people at the front desk, and when the patient doesn't show, they're calling that patient, and then they're, instead of marking the patient as a no-show, they're actually rebooking the patient, and so it looks like the patient was just rescheduled instead of popping up into that report as a no-show. That happens. That is a really common problem. Now, I want to emphasize that that staff member is doing their best to provide the patient with fantastic service, and that's all wonderful, and getting them rescheduled, it's great, but they've got to be further trained to understand that they've got to book that as a new appointment and make sure that you can capture that no-show information so that you know more accurately what your no-show rate is. Another tool that's really useful when you have an integrated EHR and practice management system, there are timestamps that you can use to track when the patient checks in, when they're roomed, when the doctor comes in the room, when the doctor exits, when the patient checks out. In most cases, we find practices are only using maybe 2 of those. Like maybe they're marking when the patient has arrived. Maybe they're marking when the patient checks out. Sometimes not even that. Now, the problem is that it's a little bit tedious to enter that data, but if everyone understands why, it can be so valuable to have everyone entering that data, because it gives you an incredible look at your workflow. If you can actually track when the patient's roomed, when the doctor arrives in the room, when the patient visit completes, you get a much better sense of how long people are spending in those rooms. And that can be a real source of aggravation for the patient. You may also learn that your appointment slots are not fine-tuned as well as they could be, and that can potentially give you the chance to make your physicians more productive, or at a minimum reduce their stress if the slots are too small in some cases. So there are undoubtedly features inside your system that you may never have been properly trained on using, or staff may never have been properly trained on using. And if you can learn how to use some of these things, that can really add a huge amount of value. The other thing is that, you know, when we look at one of these practice management systems with our clients, oh my goodness, there are a lot of reports. I mean, there are like literally pages of reports a lot of the time, and the names are often kind of similar and confusing. And so you may not be using a report that gives you exactly what you need. Now, one really positive trend is that a lot of these systems are starting to offer customized reports where you can actually log in, design your own report, or design your own dashboard so you get a glimpse of the metrics that matter to you every day. Ask your vendors about that, because some of these things may have been rolled out, you know, since you got the system. So you may not be aware that these new capabilities have been added. You also, you know, it never hurts to check in with your tech vendor and ask them just in general, hey, I'm trying to analyze, you know, this aspect of our practice. You know, is there a report that can really help me with that? You know, sort of cut to the chase rather than having to, you know, try to run 10 different reports yourself and see if they deliver you what you need. The other thing is that sometimes we find that practices hold back because they're worried about HIPAA. For example, with electronic statements and, you know, paying for patients paying their balances over the internet. I think that, first of all, it's really a good idea to quiz your vendors and make sure they understand HIPAA and they're, you know, incorporating that in their development process, and that they have a business associates agreement with you, so they're taking responsibility for their portion of HIPAA, and to learn also from them what the process is and how it works. Usually when it comes to electronic statements and paying online, the information that gets sent to the patient over email is not sensitive. Usually what happens is they get sent a notification that they should go to the portal where they can then securely view the you know, more sensitive information and make their credit card payment in a secure environment. So, you know, sometimes concerns about HIPAA cause practices to hold back. First of all, quiz your vendors to see, you know, if you can get reassurance from them that yes, they have absolutely taken HIPAA into account, and then also just understand that the way some of these things are set up is actually built with HIPAA in mind. And, you know, all of this, I think, kind of boils down to don't miss out on some opportunities to try some of these things because maybe you have some false assumptions that are, you know, holding you back.
Outstanding. Well, let's talk a little bit about office workflow for a moment. With the changes in technology, there would seem to be parallel changes in the way that we work in an office, or just a change in the general flow. And how can we then optimize those changes to make the most of not just these technologies, but of our staff?
Well, so I think that when you're adding new technology, it's really a good idea to consider changing up your workflow to get the most out of it. I think that, you know, it's a little bit intimidating, but there are certain aspects of the workflow that can really inhibit you from getting the most out of the technology you're deploying. And I want to give one example because I feel like this one is so important. If you are not checking eligibility until the patient arrives in the office or until a few days before their appointment, if that's the first time you're checking eligibility, you have much higher likelihood that that patient will actually be ineligible, and then you'll have to reschedule them. If the patient's been waiting for a while, they're going to be unhappy. It's just, you know, it's just a situation that can turn sour, and it doesn't need to. If you can think about changing up your workflow a little bit, move that eligibility checking process to the same time as scheduling, and consider actually having some members of the team who are focused only on scheduling. You know, even for a small practice, you could have just one person whose job it is to answer the phone and schedule those appointments. Maybe there's a little spillover if that person is busy. The receptionist can sometimes answer the phone, but allowing someone to focus on handling those calls will enable them to spend a little bit more time with that patient. They can check the eligibility in real time using that real-time eligibility tool. Only takes, you know, a few seconds, up to a minute maybe. It's pretty quick. And then they can take a little extra time to also explain to the patient what their payment responsibility is, so that when that patient arrives at the front desk, the check-in process can go much more smoothly. They're prepared to pay. They're not going to be surprised. If the patient by chance has a balance and wants to set up a payment plan, that scheduling person can be trained to be able to do that as well. And so you're shifting more of the workload to the front end, to where scheduling is happening. So you have to allow for that, right? Because the scheduling is going to take a little bit longer, but you're avoiding a lot of problems. You're going to get paid more reliably, and then you're going to take back some time at the, at check-in time, because less work has to be done at that time. So this type of, shift and this type of automation, such a win-win, because you're avoiding so many problems. You're increasing the likelihood of getting paid, and you're making it easier for the patient to pay, which they're going to really appreciate. So this is the kind of thing that I really recommend that you prioritize. But as you think about adjusting those jobs or shifting those tasks, you're going to have to keep an eye on it at first and kind of see how the workload moves, and where you need to add staff, where you can afford to shift them into other roles until you get it exactly right. There's a little bit of an art to it. And of course, you want to continue to cross-train everybody, because as you're learning, you may not be able to project exactly how much manpower it's going to take in each of these roles, and so you want to make sure everybody is able to pitch in. And in some cases, it can be really useful to roll out in stages. Like we worked with a practice recently where they just shifted one person over to handle the scheduling and do the eligibility check-in and doing this more enhanced form of scheduling. And then the rest of the calls that this person was not able to handle just spilled over and got handled the way they always had been in the past. But they had one person who was kind of like, you're able to be the leader, if you will. They're leading the charge, and they're troubleshooting and figuring out how to do the job well, and also giving the administrator the chance to see how long it really takes to schedule in this way and how much manpower they really need to have in that role.
Another key element that you've been talking about is changing the norm around collecting payments from patients, the use of patient portals. What are some tips to protecting that patient data and maintaining compliance with HIPAA and other systems?
Well, I think I mentioned credit cards on file, and also, many of the solutions we're talking about, like setting up payment plans, for example, will involve, storing credit card information in some fashion. It's really important to look for tools that are PCI compliant. PCI stands for Payment Card Industry. That's the kind of the governing body for the credit card industry. They have a very high standard for how information should be managed. Back in the olden days, it was considered okay to keep the information in written form as long as you kept it under lock and key. That is no longer the standard. Today's standard is much higher. And when you use a PCI compliant solution, the credit card information is actually not even stored in your own system. It's actually stored and encrypted in another location. This is fantastic news for you, because that reduces the risk that you have of that information falling into the wrong hands via your system or via anyone in your practice. And you got to remember that credit card information is important to the patient, not just because of the financial risk, risk of identity theft, but also because it ties the patient to your practice. So it's really a form of protected health information as well. So very important. Look for PCI compliant solutions. Most of the time, if you find that there's something inside your practice management system that you can use, the vendor's going to tell you right away that it's PCI compliant. But if they don't, just make sure that you ask. With respect to your systems, make sure that you also are checking the access levels that you've assigned to your employees. Nobody should be assigned any more access than they actually need. So, for example, if someone doesn't need access to the EHR, only the practice management side of things, don't give them access to that. Make sure that your access levels are as controlled as they can be, and make sure also that you know how to audit who's accessing the system, where the logs are located, how you can run a report, and check to see who was accessing data if you're ever concerned about any kind of breach. I already mentioned that the way to deal with giving patients secure access to their information, whether it's health information or the ability to pay online, is to send them to that secure environment where they can perform those transactions. So you're not really sending any sensitive information in email form. You're just directing them to go to where they can look at that stuff and perform those transactions securely. Make sure everybody knows about password hygiene. You know, no passwords on Post-its. We still see this, passwords underneath the keyboard. You know, that's it's really important to make sure people don't do that, that they pick a password that's easy for themselves to remember but hard for someone else to figure out, because, you know, it's not just other employees. You have a lot of foot traffic coming in and out of your practice, and you really don't want those passwords to fall into the wrong hands. And then finally, make sure everybody's been informed about phishing. So phishing has become a huge problem in every industry. The people who are launching these phishing schemes are getting very clever. Make sure the easiest way to prevent this kind of thing from happening in your practice is to make sure everybody knows not to download something or click on a link unless they were expecting to receive it. So unless you know for sure that a document you're about to open came from someone that you knew you were going to receive it from, don't click on it.
I think it's all really important. It's good. It might seem like a refresher course to some of you, but I don't think it can be stated enough just to keep reasonable security practices in mind pretty much all the time. And there's a lot of ways to help to both mitigate and minimize the risk that we're under, certainly with the front office. And like you say, sending them to a portal alone for the strong majority of that interaction it covers you in a lot of ways. Rounding it out today as sort of a summarizing question, Laurie, what do you think are the most important tactics to maximizing the benefits of front office technology?
So here are my top tips for getting the most out of front office technology. First, I just want to urge everyone to rethink their process for capturing patient email, because so many of the tools that we're talking about, whether it's allowing the person to schedule themselves online, online payments, the payment portal, even reminders, all of these things depend on having an email address. And we work with a lot of practices who first asked the patient to provide their email maybe 5 years ago or longer. Sometimes those emails are no longer good. And sometimes the patient may have said, oh, I don't want to provide my email. Now, it's really important to check in with the patient periodically about that, because a lot of times their answer will have changed. Over these last 5 years, we've all been learning about how much more convenient it is to be able to receive our statements electronically and be able to make payments electronically. And once the patient understands that providing that email opens the door to that, they are probably going to be much more interested in providing you with that email. So make sure you have a strong process in place and everyone understands why it's so important to collect that information. That relates to this idea of getting the entire team on board. Make sure your staff understands that by collecting this information, they're going to give the patient something that they really want. They're going to make the process much more efficient. They're going to really benefit the practice and patients. I mentioned before that you can identify employees potentially inside your practice that could be key vendor liaisons. If you are a really busy administrator, busy manager, busy physician, you, in all likelihood, do not have time to read through all of those updates and release notes, but there may be someone on your team who is really great with technology, who has a passion for it, who may love the opportunity to have that official role. So think about assigning that to a really interested staff member. And then last one probably goes without saying, but I think it's just really important to not let a bad prior experience with technology cause you to shy away from trying new things, or being sort of closed-minded about it, or concerns about costs. So many of these systems that we've talked about today, they may be free. They may already be inside your practice management system. They may come with a small cost just to activate them, or maybe they come with credit card processing fees. And they're usually very, very easy to implement. We worked with a practice recently that turned on their payment portal and started sending out a few electronic statements that afternoon. The next morning they came in, they had money in their bank from people who were paying online. I mean, it was amazing. They were so happy. And I guarantee you, if you haven't turned on, electronic patient payments in this fashion yet, when you do, you're going to be so pleased to see that money coming in with no collection costs whatsoever. So don't shy away from new things if you can, and just try to keep learning about what's out there. There's some great innovation happening.
Laurie, all really good points there. Thank you so much for this presentation today. This was really a really refreshing take on a topic that I think really resonates well with practices of almost any size. We'd like to open it up quickly for questions from our live audience now. do have one question that came in right off for you, Laurie. What is the best way to learn how to use the unused features in the technology you're already using? My staff is a little bit old school. How do I get my employees on board to embrace these more modern technologies?
Oh my gosh, that is a great question. I'm so glad to have the opportunity to share this tip. I think that if your staff's old school, you may not be able to take advantage of the idea of setting up a liaison. But one thing you could potentially do is talk to your account rep at your different platform vendors, at your practice management system and or your EHR. If they, probably, in all likelihood, they're the same vendor, but if they're not, what we're talking about mostly here is the practice management system. And see if you can get a twice-a-year update. Just see if you can have a conference call or presentation for the staff once or twice a year where the person from the vendor will walk you through all the different improvements that have happened and just highlight some of the most important features that you may not be using. I think after you've been using a system a while, that's actually the best time to get some more training. What tends to happen is when you first launch the system, it's so overwhelming. You just want to learn the basic things that allow you to get through the day, do the things that you absolutely need to do. After you've been using the system for a year or two, it's much easier to contemplate trying out some of the new features. And so that can be a great time to just talk with someone at the vendor and see if they're able to give you that sort of presentation.
I think it's a great point. Yeah, the familiarity over time, even just knowing where something is on the menu makes a big difference on something you might not implement right off the bat. Another question came in. While my current practice management EMR isn't quite meeting our practice needs, my staff is hesitant to switch to a new system. Could you offer a few words of advice on key factors to consider for a smooth transition? And this is a long one. And what can potential timing to the switch look like?
So gosh, of course I can appreciate how intimidating it can be to think about making a switch like that. So I think what's really important is to take your time on the front end and make sure you are really analyzing what you like and what you don't like about your current setup. What are the things that you would like to have improved in the new system that you're choosing? And also, what are the things that you want to make absolutely sure you don't lose? Like, what are the features that you're using every day that have to still work properly? And just take your time with that. Now, there are lots of different ways you can learn about other systems that are out there to try to do as comprehensive an analysis of the market as you can. For example, if you go to any kind of conference that's hosted by your specialty society, lots of times the technology vendors that have tailored the system somewhat to your specialty will be exhibiting at those conferences. That can be a great way to learn. Of course, you can talk to other practices in your specialty. I think that you can also even find people either like via the MGMA forums or on LinkedIn. You can find people that are in your specialty to tell you a little bit about the system they have, what they like and what they don't like about it. If you're a physician, there's a great community called CERMO that is just for doctors where you can talk with other doctors. But I think the most important thing is to really do that homework up front, both understanding your own needs and documenting them as fully as you can, and then just taking the time to see what all is out there. By the way, Colby, do you recall last year we did a webinar together about choosing a new EHR?
Absolutely.
And I'm wondering is that recording still out there, because that that could be a valuable thing for this.
It is, and it's a very good one. I'll find it. It is definitely within the Quantum YouTube channel does have it there, but I'll also include it in the follow-up documents to this session. I'll send it as part of the follow-up materials, a link to it.
That would be great, because we went into so much more detail there than I can do now, and I think hopefully there's some helpful information in that presentation.
Well, we do have a couple more questions, but in the interest of time, we're going to go ahead and keep moving and answer those offline. Laurie's contact info is on the screen now, and as I said, if we didn't get to your question, we'll follow up with you later. Laurie, thank you once again for your presentation today.
Oh, it was my pleasure. Thanks very much for the opportunity.
Anytime. And we'll turn our attention to our sponsor, the Quantum Healthcare IT portfolio. Quest Quantum offers a complete end-to-end solution for all of your practice needs. We focus on the business side of things so that you can focus on your patients. We have the range of technology solutions to support your practice in every way, including those mentioned during the session today. We connect healthcare organizations, community physicians, and patients to improve access to information and insights. Our applications work harmoniously to promote physician loyalty, provider collaboration, and positive patient outcomes. And because we're backed by Quest Diagnostics, you know that you can rely on a stable and proven partner. Our network is strong, connecting over 470,000 physicians and touching the lives of over a third of all Americans every year. The confidence and reliability that comes standard with every Quest Diagnostics relationship is easy to appreciate and to benefit from. Our holistic suite covers every aspect of your patient and practice lifecycle, from appointments and reminders, documenting a patient visit, verifying insurance and processing payments, and right through integrated follow-ups via our MyQuest patient portal. If you're looking for a complete solution from a single source, we have you covered. Our electronic health record is an ONC-certified, award-winning product that works extremely well with small practices like yours. It is cloud-based with powerful mobile integration to your smartphone or iPad, allowing you to work wherever and whenever it's convenient for you. The practice management side allows your front office to work more efficiently to manage the flow of patients, keeping your practice organized and agile, linking directly to your EHR so that you can spend more time focusing on your patient and billable encounters instead of on front office administration. And if you're considering an enhanced medical billing service, Quantum RCM is an outstanding revenue cycle management product as well. Few things are as time-consuming for your practice as billing and collections, and handing off the more monotonous busy work can free your staff to focus on patients instead of spreadsheets. Trust us to provide you with a solution that's up to date on the evolving trends and changes in the industry. If you have more questions about the Quantum Healthcare IT portfolio, please feel free to call or email using the contact information on the screen. And once again, we thank you all for your attendance today. And of course, a special thanks to Laurie Morgan and Quest Quantum for sponsoring the event. Keep an eye on your email inbox for additional seminars covering related issues in the near future. This will conclude today's presentation.